Hello and a very good evening to all those joining me on this Newsline Facebook Live. Wishing all our viewers a very happy Onam as well. And I'm here to talk about the latest number of cases that have been reported in Karnataka and a plan from the Karnataka government in battling COVID-19. Now, Karnataka's total number of cases, the coronavirus cases, has surged past 3,30,000 weeks after it seemed like the situation was getting out of control. There are no signs of the virus spread slowing down, and the government is taking a few efforts and the numbers continue to rise. Of course, the testing has also increased, but more importantly, by now the situation should have come in control in Karnataka. So in its effort to better battle the spread of the virus, the government has now decided to conduct a Sentinel survey. Now, this survey is being conducted to gauge the prevalence of COVID-19 infection among people and to also take measures to prevent the spread. So this is a survey that helps the government in understanding how much it has spread, and we're talking about not just the cases where testing has been conducted, because there may be several other people as well who might not be getting tested, whether it is because of accessibility or because they don't have symptoms, but they still might have COVID-19. So this is the kind of survey that will help the government gauge how many people have been affected with the virus. So this Sentinel surveillance is conducted to detect the community transmission as well. We also had the Kerala government initially admitting that yes, we are in stage of community transmission, and it was because of a survey like this that it was possible. So this survey will also help in providing early warning signals as well as epidemiological information that the experts in the state will need. The state population in such a survey is divided into 7 groups, and this is based according to the risk factor in each of these sections. This could also mean not just location wise being conducted, but also in terms of the risk factor, which means how many people have been exposed to it. Say for instance, essential services, these personnel were working even though there was a lockdown, so they were at a higher risk of contracting COVID-19. So this survey would focus on them. But in Karnataka, the survey that is all set to begin, there has been a bit of a delay. It was supposed to begin on August 20th, but there was a slight delay. So it will be conducted very soon. But there is a big problem in Karnataka, and that is that even if the survey is conducted, it might not be as impactful as it was in a few other cities where it was conducted, including Mumbai. Now, this exercise has been designed in such a way that the findings may be extremely broad, too diluted, and it might not give the true picture of what the situation is like in Karnataka. And that's because the sample size that in Karnataka they've decided to take is extremely low as compared to the other cities. So in proportion to the population in Karnataka, this survey is going to not give a clear picture of the spread of coronavirus. There are cities like Pune and Mumbai as well, where it was conducted. This Sentinel surveillance was conducted as well, and that gave a better picture of what the situation was like. But in Karnataka, even though it's going to start this week, the state has decided to test high-risk zones across the state. This would include the 8 zones of BBMP, because there has been a surge in the cases, and the bulk of the cases have been reported from Bengaluru. Initially, it was limited to only Bengaluru urban and Udupi. Now it has been brought down to the other places in Bengaluru as well, all the wards. But in Mumbai Sentinel survey, for example, there were over 6,900 people living in slums and non-slums who had been checked for the virus. And the results also yielded some of the results that showed that 57% of those in slums and 16% of those in non-slums had showed that they had antibodies, which means that they had contracted the coronavirus, whether they had tested positive, whether they had taken the test or not. So this gave a broader perspective of how far the spread has been in the community, and this also prepared the government much better in battling COVID-19. But in this case, in Karnataka, it's a very small population that is going to be taken into consideration, which is why it might not give a clearer picture, which means that the entire exercise could be counterproductive as well. So in the survey that will be conducted in Karnataka, like I said, those who are at high risk are going to be tested first, which means the transport workers, the medical staff, the vegetable vendors. There are several others who are working even during the lockdown. They are the ones who are going to be checked first. but because the sample size is going to be extremely less and it's not going to give a correct picture of the entire situation or the spread of the virus, perhaps the entire exercise is going to be counterproductive for Karnataka. So it would be better if the Karnataka government takes a leaf out of the book of Mumbai, what was done in Maharashtra, and something similar is conducted in Karnataka as well. The authorities are, of course, taking several measures to ensure that the spread of the virus is contained, but there have been several misses as well in Karnataka. Let's hope that this time around, when the Sentinel survey is conducted, it doesn't turn out to be the same and it helps the authorities in better fighting coronavirus. I hope you're doing well at home, and please take care of yourselves. As long as the government is doing its bit, we, the people, also need to do our bit. So stay home as much as you can. Stay safe. I'll see you in the next video.